As I coach physicians and physician leaders from across North America during this global pandemic, I'm hearing about many of the difficulties people are having, and much of it has to do with an emotional response. And we experience in a difficult time like this such an array of emotions: sadness, grief, guilt, anger, frustration, annoyance. And I think it's fair to say that in healthcare, we learn little about how to manage our own emotions. In other words, emotional intelligence. So, what I'd like to talk about today is four things that you can do to become more resilient to all of the emotional vicissitudes that can occur during a difficult time like this. My name is Dr. Gail Gazelle. I'm a part-time assistant professor at Harvard Medical School, a former hospice physician, and an executive coach. Over the last decade, I've had the privilege of coaching over 500 physicians and physician leaders. So let's talk about these four things. The first is getting to know your emotional weather pattern and taking your emotional temperature. We all have patterns of emotional reactivity, things that can trigger us into an emotional cascade. And the more we can get to know them and actually take our emotional temperature, the more likely it is that we can work with ourselves so that we act in a professional manner and don't regret later on what we've said or done. Along those lines, the second thing is getting to know your emotional triggers. Triggers, sometimes when we have a strong emotion, it's because we've been triggered by something someone has said or done. Some very important triggers that I think are very active in healthcare: one, not feeling like we're respected. And given all the dysfunction in healthcare, it's not uncommon that that comes up for us. We may also have a sense that we or someone else has not been treated fairly. It's important to get to know what triggers you into emotionality, because then you can spot it. And once you can spot it, you can begin to see the early warning signs. And just as we tell patients with hypoglycemia or stroke warnings, we want them to get to know their early warning signs, and triggers can help us do that. The third thing is avoiding judging yourself. How many times have you experienced an emotion and thought something like, what is wrong with me for feeling this way? Everyone else is so happy. Why am I feeling sad? Or during this difficult time, everybody else is patient, having their kids home 24/7. What's wrong with me for experiencing all of this frustration, anger, and impatience? We can really pile on the judgment on top of the emotion that we're feeling. And what I've seen over and over again in the hundreds of physicians that I've coached is when we can actually activate that muscle of self-compassion, when we can pause all of that judging of ourselves, we're actually freer to change and to do things differently. And the last thing, the fourth thing that I'd like to go over, is the critically important thing to remind yourself that all emotions pass. They actually pass within about 1 to 2 minutes, a very short period of time, and yet when we're in that emotion, it can feel like it is never going to end. So that fourth thing is critically important. Remind yourself, this too shall pass. So I hope that these things can be helpful to you. Getting to know your emotional weather system and taking your emotional temperature, identifying triggers and early warning signs, building that muscle of self-compassion, pausing all of that judging and judging and judging that's often directed toward our own actions, and actually viewing ourselves with more compassion. And then reminding yourself, the fourth thing, that emotions will pass. I really want to encourage you to get familiar with these four factors. I think you'll be pleasantly surprised that they will help you build your resilience in this amazingly difficult time.